So in this video, I will be talking about a young mother who is showing us signs of postpartum psychosis, which is a psychiatric emergency. Again, I will be reading from the Word document that I made for this assignment. I want to talk a little bit about this patient's background. Our patient is a 19-year-old female who recently had a baby about 2 months ago. She is married and is coming in for her fourth follow-up visit after giving birth. At her earlier visits, she appeared calm, appropriately dressed, and caring towards her baby. However, at today's appointment, I immediately noticed that something is very different. She is wearing more provocative clothing than usual and has heavier makeup, which is unusual for her. She seems very energetic and restless. Her speech is fast, loud, and hard to follow, jumping from one topic to another. When I ask how she has been doing, and she starts talking about a video series on aliens she has been watching. As she continues, her speech becomes more disorganized and she makes unusual connections between what she saw in the videos and her baby. She says she believes that her baby is actually an alien and she has been chosen for a special mission. She plans to take the baby to the desert this weekend so the aliens can come and take him back. Her husband is sitting quietly and looks very concerned. When I ask for his perspectives, he tells that she has been acting different for the last couple of weeks. She has been staying up all night, talking rapidly, and making a strange statement about the baby. He also says that he is afraid to leave her alone with the baby. Although the patient denies wanting suicidal ideation or homicidal ideation, her belief that the baby is an alien and her plan to take the baby to the desert are extremely concerning and dangerous. This is not typical new mother's behavior, and these symptoms, which are delusions, confusion, and disorganized thoughts, strongly suggest postpartum psychosis. So I want to talk a little bit about postpartum psychosis. It is a rare but very serious condition that can develop in the weeks or months after childbirth. It affects about 1 to 2 out of every 1,000 new mothers, and the symptoms can include hallucinations, delusional thinking, extreme mood swings, agitation, and confusion. Unlike postpartum depression, which is more common, postpartum psychosis can appear suddenly, quickly, and quickly become life-threatening for the both mother and the baby if it is not treated immediately. So at this point, my top priority is safety for both the patient and the baby. Even though she is not actively threatening to harm, her delusional belief and poor insight means she might unintentionally harm her baby while trying to return him to the alien. um, I would calmly but firmly keep her in the clinic and make sure that she is not left alone with the baby. I would reassure her that we just want to help her and keep her and the baby safe, and then I would contact emergency psychiatric services to request an emergency evaluation and possible involuntary hospitalization. So for the immediate actions, I would do so these are the things I would do right away, which is to ensure safety, that is to keep her in a secure and calm environment. And another one is keep the baby safe. The husband or a nurse can care for the baby while the help arrives, and call emergency services, arrange for the patient to be taken to an inpatient psychiatric facility for stabilization. And the fourth one is document carefully. So I would record everything said about her behavior, her husband's statement, and the plan for the transfer. So legal and clinical consideration would be in Wisconsin. I live in Wisconsin, so in Wisconsin, under Chapter 51, a person can be placed on an emergency hold if they are a danger to themselves, to others, or unable to care for their independence due to a mental illness. Excuse me. In this case, her belief about the baby being an alien and her plan to take the baby into the desert clearly put the baby at risk. This makes her eligible for an emergency detention to protect both her and her infant. Now, treatment for postpartum psychosis often includes antipsychotic medication to reduce delusions and hallucinations. Some women may also need mood stabilizers if there is an underlying bipolar disorder. If she is very agitated, short-term benzodiazepines might help calm her until the antipsychotics take effect. Because she is a new mother, it is very important to coordinate with OB and pediatrics, especially regarding breastfeeding safety. Um, After she is stabilized in the hospital, her recovery plan would be continuing psychiatric care with close medication monitoring, therapy, and education for both her and her family to help them understand the condition, encouraging her husband and family to participate in her recovery and to monitor for warning signs in the future. If there is ongoing concerns for the baby's safety, involving child protective services may be necessary. The goal is to help recover while also ensuring the baby remains safe and well cared for. With early and proper treatment, most women recover fully from postpartum psychosis and can return to normal functioning. So, as a psychiatric mental health nurse practitioner, this case remind me how important it is to stay calm, supportive, and non-judgmental. Postpartum psychosis is not a mother's fault. It is a medical condition often caused by hormonal changes and stress after childbirth. The key is compassionate care that focuses on safety, trust, and long term healing. So, in conclusion, postpartum psychosis is a serious psychiatric emergency that requires quick action. By recognizing the warning signs early, ensuring safety, and arranging immediate treatment, we can protect both mother and the infant. So, recovery is possible with the right medical and emotional support. Thank you.